Today I, Dheere Nagpal from Group 8 will present our OSCE presentation for PEDIA. Now, when we talk about taking OSCE in PEDIA, there are very delicate steps that we should know and follow. The first thing that comes is history taking. History taking. Complete history is necessary and it leads to the correct diagnosis of vast majority of children. Usually is obtained from the parent, the older child or the caretaker of the sick child. A short, rapidly obtained history of the event of the immediate past may suffice temporarily, but as soon as the crisis is controlled, a more complete history is necessary. A convenient method of learning to obtain a meaningful history is to ask systematically and directly. Allow the parent, caretaker to talk freely at first and to express concerns in his or her own words. The interviewer or doctor should directly look either at the parent or the child intermediately and not only at the writing instruments. There should be a one-to-one dialogue that should be created so that the parents can openly tell about the problems that the child is having, or the child can openly tell whatever issues he or she is having.
A very good evening.
Good evening.
Myself Dheere Nagpal. I'm a doctor. What happened?
Doctor, she's having stomach ache.
Okay. When did the stomachache start?
2 days before.
Okay. Is it getting increased?
Yes.
So are you feeling right now also?
Yes.
Okay. Did she eat something from outside or something like which is not good for her tummy?
I love spicy noodles.
From morning to night, she eats spicy noodles, burger, chili garlic pizza, everything almost that contains chili. She eats everything.
Okay, I see. Children's diseases eat all this kind of food. You really love that spicy food that much?
Yeah.
Yeah, she needs to order right now also. Should I order right now?
Okay, it's fine, it's fine. Don't get angry over your child. You just need to consult her a good food eating habits, that's all. But still we will have to examine her abdomen to look if there is no other problem that is causing this. So shall we start with the examination of the abdomen?
Yeah, sure.
Do you feel like urinating right now?
Yes.
Okay, you go and use the washroom and then we will start with the procedure.
Okay.
Ma'am, I will need you to be there in the room with her while I'm doing the examination, as we need an adult, consulting adult to be in the room so that the procedure goes on smoothly.
Yeah, sure.
The chief complaint for today's patient, given in the informant or patient's own words, the chief complaint is a brief statement of the reason why the patient was brought to be seen. Today, the case we are going to discuss is of a 14-year-old female with abdominal pain. Physical examination. When we talk about physical examination, it is one of the very important part in the procedure. Examination of the infant and young child begins with observing him or her and establishing rapport. It is wise to make no sudden movements and to complete first those parts of the examination that require the child's cooperation. Painful or disagreeable procedures should be referred at the end of the examination, and these should be explained to the child before proceeding. It is very important to inform what you are performing to the child or the parent or the guardian accompanying the child. For the older child and adolescent, examination can begin with the head and conclude with the extremities. The approach is gentle but expeditious and complete. Only the part that is being examined needs to be uncovered and then it can be clothed, except during infancy. Modesty should be respected and the child should be kept as comfortable as possible so that you can do your examination effectively and the child is also not disturbed. With practice, the examination of the child can be completed quickly, even in the most critical emergency states. Now, when we talk about examination of abdomen specifically, the order of examination has to be changed slightly. Yes, first we perform inspection, then auscultation, then percussion, and at last palpitation. Talking about inspection, It is a good idea before performing abdominal examination to ask the child if they need to use the restroom. Inspection is the most important first step. For the examination of the infant or toddler, the knees must be bent in order to relax the abdomen and the child's arm down at their side. Inspect for rashes, scars, lesions or discoloration. Observe overall contour and symmetry. Inspect the umbilicus for shape, sign of inflammation or hernia.
Make sure when you're doing the exam, a consulting adult is present in the room with the patient. Now when we begin the exam, first we inspect the abdomen for any rashes or scars. The abdomen looks fine. There are no scars.
Auscultation. Auscultation of the abdomen should be done before palpation or percussion, since the latter may alter the frequency and quality of bowel sounds. Listen to the four quadrants, noting the frequency and quality of the bowel sounds. Abnormal sounds are like gurgles, clicks or growls. Frequency of sound is from 5 to 34 times per minute. Percussion in the pediatric patient is the same as the adult patient because children tend to swallow a lot of air while eating or crying. The stomach and intestine have great amount of air in them. A distended abdomen may signify an obstruction, infection, celiac disease, ascites or an abdominal mass. Palpation will reveal masses, note size and location, hepatosplenomegaly or any sources of pain. If the liver is felt below the costal margin, it commonly is 1 centimeter below the margin, its span is in the mid-clavicular line, should be percussed. Always remember, you have to be very delicate when you are dealing with children. Note your findings and report them to the guardian and the child if he is grown up enough, and then proceed with the treatment plan.
After doing the examination, what we can say is that the pain in the upper left quadrant and the middle area of the abdomen on the upper side, that is all because of indigestion. You told me that she likes to eat spicy food, but we have to keep that in control. The major thing that we can do right now is her diet change. There's nothing to worry. As soon as she starts eating healthy, she'll be fine. So just have a good look on her diet, and still if something happens and she's getting that heartburn or the indigestion, I'll write some antacids for her. You can give it to her whenever she feels bad. Okay Vani, from now on you have to eat less spicy food and take care of your tummy. Okay? Okay, thank you.
Thank you.
That's all for the presentation of OSCE from our group A. Thank you.